Spinal cord injury is truly a life-altering event. It's difficult to grasp how something that happens in the blink of an eye can change your life forever. And many of us assume the biggest issue for those having suffered an injury is the impairment of motor function and being confined to a wheelchair. However, what you may not realize is one of the most disabling, impactful, and arguably overlooked consequences of traumatic spinal cord injury is the impairment of bladder function. See, after injury, there's a lack of communication between the bladder and the brain, which results in a host of pathological consequences, some of which can be life-threatening. What urologists are most concerned with is pressure. After injury, the bladder and its outlet can contract simultaneously, shooting pressure up within the bladder and driving urine back up the ureters into the kidneys, which can cause renal deterioration and even kidney failure. Now, treatment options exist, but what is needed is proper assessment to determine which patients are experiencing these high pressures and which are most at risk. Presently, the gold standard for the assessment of bladder function after spinal cord injury is a technique known as urodynamics, which involves placing a catheter through the urethra into the bladder to do two things. First, to record pressure. Second, to artificially fill the bladder with saline. This is a particularly unnatural test because of the presence of the catheter in the urethra, which can impede flow, it's uncomfortable, it's irritating. All of this can interfere with bladder function and cloud its subsequent interpretation. So, in collaboration with the Cleveland Clinic, we've developed the Uromonitor, a wireless device capable of monitoring bladder function without the use of catheters. This would revolutionize the way bladder function is assessed today, allowing clinicians and scientists to observe the bladder as it fills and empties at its own rate. The device can be inserted and left for up to 5 to 7 days, opening up a never-before-seen window to how the bladder is truly functioning. So, to facilitate the clinical translation of this device, the goals of my PhD will be threefold. First, we will compare the Uromonitor to the gold standard assessment tools during urodynamics in a preclinical model of spinal cord injury. Second, in the same model, we will assess how the bladder is functioning during free movement without the use of restraint or anesthetic, something that's never been done in this species. Finally, we will conduct a clinical trial at the Cleveland Clinic to see how this device functions in human patients. Overall, this study will help us better understand the impact of spinal cord injury on bladder function and allow us to detect these high pressures before it's too late. Thank you.